Hi, my name is Janelle and I have a Bachelor of Science in Nursing, and today I'm going to be making a video about asthma, and it is also known as reactive airway disease. This video will be for the purposes of educating pre-licensure nursing students. I will discuss about the disease process and any nursing related concerns. Asthma is a clinical syndrome characterized by an increased responsiveness or reaction of the tracheobronchial tree. Now your tracheobronchial tree is located, the trachea is here, and it bifurcates into the lungs here. That is your tracheobronchial tree. During asthma, these areas get inflamed and they cause an inflammation due to different stimuli. Every person may have a different stimuli that causes the reaction. In this reaction, some of the triggers could be a respiratory infection, cold weather, physical exertion, medications, or allergens. So what happens is when the person or the patient is exposed to these triggers, it starts a fast-moving inflammation process. In this disease process, the patient will usually start to cough uncontrollably. These are called bronchospasms. As this occurs, mast cells release inflammatory mediators into the area, and this causes swelling and spasms and mucus, and you will be able to hear adventitious breath sounds like wheezing. This will cause, if it's not treated, it causes more mucus and tightening, and the patient will feel like they cannot breathe. Other symptoms may be dyspnea, meaning you're having a hard time breathing, tachypnea, which means you're breathing fast, cyanosis, which may include the lips being blue, the fingernails being blue, a cough. Especially in children, you will see accessory muscles being used. Now adults will use the abdominal cavity to get that breath out and in. On infants and small children, you will see retraction of the skin up here, and in between the lungs you'll see retraction here. Also, there might be prolonged expiratory. So what happens when this occurs is mast cells release, as I said, the inflammatory mediators into the area. Eosinophils and neutrophils rush into the affected area. Cytokines are released. Some are long-acting, causing epithelial damage. Late phase airway edema, continued mucus hypersecretion, and additional hyperresponsiveness of the bronchial smooth muscle causes remodeling inside of the lungs, and this is not good. It causes scarring and less area for the person to be able to consume that oxygen. Status asthmaticus occurs when the asthma attack is refractory to the same medications. Usually this happens when someone has uncontrolled asthma, or they are not adhering to their treatment as prescribed, their plan of care. Clinical manifestations become more severe every time they get it. The symptoms will be prolonged, and it could be life-threatening. On assessment, of course, I want to make it clear, if this patient comes into the office or your hospital emergency room, say it's in the office, and they look like they can't breathe, they're cyanotic, they can barely talk, you would want to call 911, tell someone to call 911. Then you would try to administer inhalers, nebulizers to the patient, probably tag them in a Benadryl to try to get hold of the episode, the inflammation that is going on for that moment. You would also want to have the patient relax, sit them in a comfortable position, sitting up. Assess the lung sounds, assess the vital signs until the emergency medical services come for the patient. Keep them as stable as possible. If this is for a regular visit, maybe the patient has come in to you and has these symptoms but don't really know what it is. It would be best to get a health history and an overall assessment of the patient, including vital signs, questions about how long have they had this symptom, when does it occur, and all this information will be gathered to make a diagnosis for asthma. The most important part is to have to be able to listen to the lungs, maybe take an x-ray of the lungs and see if there's any infiltrates in there, like for pneumonia or anything. Note the sounds, and then we would move on to prescribing a medical treatment for that patient. It may include just a rescue inhaler. It may include a visit to the specialist, the pulmonologist, in which they will do extensive diagnosis with computers, with a breathing test and other tests that they perform at that office. It's always important for the patient to have an action plan, and it will be the nurse's and the physician's goal to make sure you educate that patient about self-management so that you don't have out of control exacerbations of asthma, and it's make sure they verbalize understanding, and early recognition and treatment will be the only way to control your disorder. The doctor also may want to follow up in 3 months, 6 months, and that will be it. And thank you for your time today. Goodbye.